On the occasion of the World Lung Cancer Awareness Month, which is November, on behalf of MGM Hospital, I am Dr. Apar Jindal. I'm the Clinical Director for Lung Transplant and Pulmonology. I'd like to just share some of my views on lung cancer. One of the most basic things is why lung cancer happens. And we all know it is attributed to smoking, it is attributed to environmental pollution, it is attributed to bad habits again, like chewing tobacco and poor lung hygiene. But does everybody who does that get lung cancer? Not so. Maybe 1 in 3 is the proportion of the people getting that. What we need to remember is that most of them are going to die because this is one of the most deadliest cancer which is known. So how do we identify? How do we know? What are the warning signs that you need to get yourself checked? If you have things like a cough, if you have things like chest pain, if you have symptoms of breathlessness, that means you feel short of breath when you're walking a small distance or when you're climbing stairs. Although these can be symptoms of other diseases as well, but these are warning signs. There are some frank and obvious signs, like if you start vomiting blood, if you start coughing out blood, then it is very obvious that there is something wrong. And how do you get yourself tested? It's very simple. Get a chest x-ray, get a low dose CT scan done. If at all we find some abnormalities on that, modern medicine has evolved a lot nowadays. We can do procedures like bronchoscopy, wherein a video tube can be inserted down into your lungs from the nose. It's a procedure which is done waking up. Or if a mass lesion is picked up when you're imaged on an X-ray or an CT scan, we can put in needles into those masses and we can take samples from there. And that is the easiest way to diagnose lung cancer early. It is very, very important that you get diagnosed with the lung cancer early. In case you do have a cancer, this is a cancer which rapidly grows. So you need to identify it early and you need to start treating it early. There is a wide variety of treatments available, starting from surgery, what we call as neoadjuvant chemotherapy. That means surgery alongside chemotherapy and radiotherapy. We also have chemotherapy in the form of tablets available. Once we have good sample from your mass, we can test it for receptors, and if particular types of receptors are positive, we can give you oral chemotherapy. That means you just take tablets and that can help extend your life by a large margin. And in some cases that is even curative. We can cure this cancer. The second most important thing is to stop the offending agent. If you were a smoker, if you were a tobacco chewer, you need to stop. But does that mean that once you stop smoking, you have no chances of getting lung cancer? That is not true. It only decreases your chance as compared to the other smokers. So quit smoking now. Let's at least reduce that chance. What about the therapy afterwards? If we catch this cancer early, yes, we can operate, we can remove the tumor, and that is a one-time therapy. Again, the stress on catching the tumor early, catching the cancer early. But yes, if it progresses, the moment it crosses your chest or it goes into any other organs, that means it is an incurable disease. So any patient or any individual above the age of 50 years, any individual who has risk factors like smoking, tobacco chewing, or exposure to a lot of environmental pollution, people who are living near factories, people who are living near chemical dump areas, these are people who are more prone to develop things like lung cancer. And these are the people who should repeatedly get themselves tested, at least at regular intervals of every 1 year to every 2 years with a simple low dose CT scan. So don't be scared of getting yourself evaluated. If you have a risk factor, if you have especially any cancer history in your family along with the risk factor, then definitely you need to get yourself tested quickly.